North Carolina hospitals are seeing an uptick in respiratory illnesses.
That's right. Since last week, 2 more people have died from flu-related complications here in North Carolina. Cindy Bay is live now at WakeMed here in Raleigh to show us how we can all try to stay healthy this holiday season when we're gathering with so many people. Cindy.
Yeah, well, Steve, there's still time to get that COVID or flu vaccine and develop immunity, as experts say that they're expecting all 4 respiratory diseases to peak after Christmas, Hanukkah, and New Year celebrations end in early January.
It's the time of year when hospitals across the Triangle are dealing with a quadrupledemic of respiratory viruses such as COVID, influenza, RSV, and walking pneumonia this year.
RSV last week was roughly 70 cases. Flu was 35, so more RSV than flu, but not much in the way yet of people needing hospitalization.
At UNC Health, Dr. David Weber says they're seeing the common cold on the rise. Just last week, they had 140 cases.
The other thing we continue to see for the last 3 or 4 weeks is large number of cases of walking pneumonia. This is a bacteria, not a virus, mycoplasma, and we're running about 50 a week. Positives for the last 3 to 4 weeks.
Unfortunately, wintertime is just when we see a higher frequency of respiratory illnesses.
The latest data from the State Department of Health and Human Services show flu and RSV numbers are increasing, while COVID cases have been fairly steady.
Healthy adults will get RSV and they will get a cold, and they generally will get better on their own. It's the highly susceptible patients, particularly the neonates and very young kids, that are susceptible to getting complications for RSV.
Now, experts say this doesn't mean that you have to isolate yourself for the holidays, but they say to use common sense. And some ways to avoid COVID, flu, and RSV include covering your mouth, wearing a mask, and keeping social distance. Reporting in Raleigh, Cindy Bay, ABC 11 Eyewitness News.